policy that you do, isn't it? I thought you did research as well, which is policy unit, which we're really excited about. And she'll be doing the closing at the end. So Ashanti is the person that you should pass on at around 12 or just before 12.
Okay, so Ashanti. And she is
Good
Dr. Ashanti
morning.
as well?
No, she,
Yeah.
Okay.
Welcome to Health Hour, a session for you by Black doctors, hosted by the Caribbean and African Health Network. Ever sat in a doctor's office thinking they just don't get it? Or search for health advice online, but you can't understand it? Felt unheard? You're not alone, and you found your solution with Health Hour. Every Saturday at 11 a.m., this is your space where Caribbean and African healthcare professionals speak about health with a focus on Black people. We tackle the topics that keep you up at night: mental health, chronic conditions, preventive care, sexual health, men's health, women's health, heart disease, and much more. All with the cultural context that matters, because our Black doctors understand the unique challenges we face. Here is what you can expect: real talk from doctors who look like you and get it, lived experience testimonies, practical advice, illness prevention and management tips, and a space of understanding without judgment. You also get to ask questions. Your questions drive the conversation. Health Hour, where community meets Black health expertise.
A very good morning to you all. I hope you can see me and you can hear me wherever you are. Great. Thank you so much, Natasha. I can see the heart there. I'm glad you can hear me fine. My name is Dr. Vaughn Shuro, and I am your host this morning on our Health Hour hosted by the Caribbean and African Health Network. I would like to thank you for joining us on this amazing talk, which I've been looking forward to. And it is my pleasure to host you together with my colleagues from Cannes. And a big shout out to all our friends, family, community joining in our Windrush celebrations. I know some of you are joining all the way from Manchester. And I am so delighted this morning to welcome you all. We have an exciting conversation this morning because, as you may all know, it's been Cervical Screening Week or Cervical Screening Awareness Week. And it is my pleasure to host and to welcome Miss Dr. Natalie Nunes, our guest speaker for today. Can you see me all right? Is she in? I cannot see Dr. Nunes. I just want to make sure I can see you and I can see your smile.
Hi.
Hello. Thank you for joining us once again. And so just a brief introduction so that I can let her have the floor and we can have an amazing, amazing time of education, empowerment this morning. Dr. Nunes is an award-winning specialist gynecologist or consultant gynecologist with over 25 years experience in early pregnancy care, in the provision of evidence-based management to conditions such as miscarriages, ectopic pregnancies, and other complex early pregnancy conditions. She is a recognized innovator, and she introduced virtual reality headsets to reduce pain and anxiety during awake miscarriage procedures. So I'm standing in front of greatness this morning, and it's an absolute honor to have you here to inspire us and to tell us more. We are absolutely in awe of how you have been combining empathy and technology to improve women's experience all over the world. And I can say, certainly as a woman who suffered from a miscarriage myself, I am so delighted to see a face that looks like me, color that looks like me, right at the front of innovation, of good quality care, in the provision of management for these women. So, Dr. Natalie, without further ado, please take the floor. It is absolutely an honor, as I've mentioned, to have you with us this morning. Good morning.
Good morning, everyone. Good morning. Thank you for that very warm welcome. Thank you very much. I'm going to start sharing my slides, but just before I do, I'm just going to show you my beautiful little pendant hair. As you can see, it's a little uterus.
Oh my goodness.
All my work is designed to support women and their uterus, okay? So
Honestly, this is a first for me. I've never seen such amazing jewelry, and power to you for that. You know, a lot of women don't know what the uterus looks like, or even what the neck of the uterus looks like.
right.
So we cannot underestimate this very small but significant ways of raising awareness. Thank you so much.
No problem. Okay, so let's get this started. So, have you, girls, ladies, women, have you had your smear yet? So, let's go back. Oh,
I had mine. If I can answer that, I've
yeah,
had
okay,
mine.
great. I've had mine. Okay, so as a Black consultant gynecologist, I know that many women feel more comfortable having conversations with someone who understands their experiences. And I want to remind everyone here today that this is a safe space. You can ask any question. I'm here to answer any question that you have.
Thank you for that, Dr. Nunes. Can I just add on to that? Just for efficiency for our talk, if everybody can note down their questions, I specifically have people that I've invited for this talk, and I've asked them to ask questions from their family, neighbors, patients, friends. So please do jot them down in the chat. I will keep an eye on the chat. And we will try as best as we can after Dr. Nunes has finished giving her presentation so that we can answer as many questions as possible within the hour allocated to us. Thank you very much.
Okay, great. So why are we here today? We are going to talk about why cervical health matters, the cervix, the entrance to the womb. And we're going to talk about why prevention matters and why this conversation really matters to Black women. So let us be honest here. What puts women off having a smear test? Well, there could be fear of pain, embarrassment, lack of awareness, or previous negative health experience, cultural barriers, caring responsibilities. We know women, we put everybody in our family first before our own health. Caring responsibilities sometimes keep us from going for it. Previous sexual trauma or FGM. So I'm going to start off by what is the cervix and how we can address all the things that then keep us from coming for our smear test. So what is the cervix? So in this image in the corner, you can see that the uterus has an entrance at the bottom and two at the top where the tubes are. So the cervix at the entrance is an entrance for sperm to come up, but it's also an exit for menstrual blood. It protects the womb. So it produces mucus, and there's a mucus plug at the entrance of the cervix, which helps prevent infection. So it helps prevent harmful bacteria from the lower tract going up into the uterus and causing an infection. For fertility purposes, around ovulation, the mucus changes. So the mucus becomes thinner and it makes it easier for the sperm to pass through. Then during pregnancy, it supports pregnancy as well. It keeps the cervix stays closed to keep the baby inside of the uterus. And then when labor begins, it softens first, then it shortens, and then it opens in a fashion that is designed to slowly allow the baby to descend into the vagina and then to be birthed. So it's a beautiful mechanism, the cervix, and all that it does. Okay, so what is the smear test? So the smear test is a screening test. And what is really fantastic about this, compared to all the other screening tests we have out there, it detects changes before they become cancer. So a mammogram detects early cancers. Bowel screening detects early cancers or sometimes precancerous lesions, but a cervical smear detects changes before they become cancer. And that is so important because what it means is if you have an abnormal smear, you don't need to be worried that it's cancer. It just means something's been detected and now it can be treated to prevent it becoming cancer. So what does it test for? It tests for initially HPV, and then it also tests for abnormal cells. So most important thing, it detects changes before they become cancer, and therefore it can prevent you developing cancer. And in this image, we have got the speculum and the brush, which is what we use to collect the cells and detect the HPV on the cervix. So what is HPV? So HPV is a virus. Unlike any virus, it can be transmitted from one person to another. Generally, it's transmitted through intimate skin-to-skin contact, including sexual contact. It's very common. Up to around 8 in 10 people, 80% of people will get HPV at some point in their lives. Most people never know that they have it. It doesn't cause any symptoms typically. There's some forms of HPV that can cause genital warts on the skin, but the types that we are talking about are inside and you have no symptoms from it. Now, your body, your immune system generally clears the virus the same way you get a common cold. Your body will clear it, you'll recover. So usually your body clears it, but sometimes your body cannot clear it and is struggling to clear it. And it's the HPV that lingers that can then cause changes in the cells of the cervix, which can then over time cause the cells to become more abnormal and then cause cancer. Now, there are certain types of HPV. So there's certain ones that are high risk HPV. Now, because HPV is during sexual contact, it doesn't necessarily mean that it does not mean that you're dirty or you're unclean or you're promiscuous. It just means that you have had some sort of sexual contact, some sort of contact to your cervix or to your vulva. So, it's a very common virus. There are different types. The types that can cause cervical cancer or other types of cancers are specifically high-risk ones. If your body clears it, great.
And if you don't clear it, that's when you need treatment, which can then prevent cancer. So, vaccines. Yes, there is a vaccination for HPV. Now, HPV is associated with almost all cervical cancers, but HPV 16 and 18 cause around 70% of them. And so they've created a vaccine for HPV 16 and 18. Vaccination is most useful when it is done before exposure, because what it does is it encourages your body to develop an immunity to those strains of the virus so that when exposed to it later in life, your body knows how to clear it and how to get it out of your system. So the country had a national program to vaccinate girls, initially girls between 12 and 13, and then boys as well, so that before they become sexually active, they can develop immunity for the HPV 16 and 18. Now, if you have been exposed to HPV already, but not to 16 and 18, the vaccine can still be useful to you, but it's not part of the national screening. And it's also been shown that if you have abnormalities in your cervix already, having the vaccine can also help you clear the virus faster, even at that time, and it can prevent recurrence of these abnormalities and recurrence of the HPV. So this vaccine is really useful. And I'm just going to make a point here that I know some of our mothers have been a little bit hesitant about letting their girls have this vaccine, but actually this is really very useful because it helps prevent, and I'm going to show you the data. So just this week, they have announced that they have finally analyzed all the data for the last 5 years, and they have seen that the young women who had the cervical jab or the HPV jab or the vaccine, they had an almost zero risk of death from cervical cancer. So it's shown that it works. So if you've got young daughters, young sons, consider even for yourself, if appropriate, this vaccine has proven itself to reduce the risk of cervical cancer and reduce the risk of death. Okay, so who do we screen? So everyone with a cervix from the age of 25 to 64 is eligible. So you start getting your invite in the year running up to your 25th birthday, and then you can book it as soon as you receive that invitation. The invitation continues until the age of 64. It occurs every 5 years. It used to be every 3 years, but now they've realized the test for the HPV has been so good that if you're negative for HPV at one point in time, you don't need to be screened for another 5 years. If you get to 64 and you have had some abnormal smears in the year before, then they will invite you for more smears after 64. But generally, if your smears have been negative, it's showing consistently that your body clears HPV, and your risk of having it later on is less, and so they will no longer screen you. So the screening is not about whether you have symptoms. If you have no symptoms, you still attend for your screening. If you were vaccinated, yes, that's great, but you still need to attend for your screening because the vaccination is only for HPV 16 and 18. There are other high-risk forms of HPV. And if you're overdue, please, guys, book your smear test. Okay, at the end of this, I want everybody to have had their smear test or have their note in their diary on their to-do list to book their smear test on Monday. Contact their GP. So what happens during a smear? I hope you can hear this video, and it just shows you what happens during the smear test.
A smooth, tube-shaped tool called a speculum will be inserted into your vagina and used to open the walls of the vagina so that your cervix can be seen. A soft brush is then inserted through the speculum to your cervix. The brush will rotate a few times to collect the sample. The brush will then be washed in a specimen pot, and the pot will be sent to a lab for testing. Remember, you are in control and can stop the test whenever you want to. You can ask to lie in a different position or ask for a smaller speculum if the standard size is uncomfortable.
Okay, so for those who've not had a smear test, that's what it's like. Okay, so if you are worried that it will hurt, these are some things that you can do. First of all, tell your clinician that you're nervous, whether it's the nurse in the clinic, the doctor in the clinic. Tell them you're nervous. They will reassure you. They will be even more attuned, as they should be anyway, to every expression on your face, your movements, and try and make it as easy as possible for you. You can ask for a smaller speculum if the standard size, which is the medium size, is causing you discomfort. You can bring someone with you, or you can ask for a chaperone with you. You can hold someone's hand, and to make it more easier for you. You can take a painkiller beforehand, at least an hour before, to just reduce the pain sensations that you might experience. Practice deep breathing. Honestly, deep breathing has been proven to help you relax, reduce your anxiety. Anxiety is associated with pain. The more anxious you are, the more pain you feel. And then the more pain you feel, the more anxious you are. So what you need to do is to take deep breaths, find any way that works for you. Some people come with their AirPods and listen to a little bit of relaxing music to just, the deep breaths, deep, slow in and slow out helps keep you calm and therefore reduces your pain or discomfort. The best time to book is actually just after your period. The bleeding has just stopped. The cervix is still slightly open so they can get the cells. You feel less discomfort. You feel more discomfort when you're mid-cycle or when you're coming up to your period. So just after your period is the best time to book it. If you're postmenopausal and not on HRT, one second. Excuse me. Excuse me. If you are postmenopausal and not on HRT, the vaginal walls can be a little bit more dry, a little bit more, and you can have a little bit more discomfort. You can ask for vaginal estrogens to take in the week or two before coming for your smear test, which will make it less painful, make the vagina more soft and more pliable, and therefore less discomfort with the speculum. Ask questions. Ask them, do you want to know what they're doing now? Okay, what are you doing now? Can you tell me each step of the way as you do it? Ask them. They will do it for you. And most importantly, you can stop at any time. If at any point you're like, this is too much, please stop. Ask them to stop. So I really am saddened when I hear that someone has had a really bad smear experience. And I hope that this will not happen again. If you take these steps, stop it if you must, and then I will tell you about potential alternatives. So, I'm going to talk about FGM. And for those who do not know what FGM is, it stands for fetal genital mutilation. And FGM is when a woman's vulva, which is the entrance to her vagina, has been cut or parts cut away and stitched tighter to be stitched closed. It happens in some of our cultures. And it was traditionally done to prevent a woman from being promiscuous before her marriage. And you know, I'm not here to talk about FGM. What I am here to talk about is the fact that the vaginal entrance can be narrower for women with FGM. And if you do have FGM, then you can let your healthcare provider know about that, and they can support you. So there are different adjustments. Once again, similar to the first page, we can change the direction that we hold the speculum. And it's really important to let them know so that they can see how best they can help you. Okay. So what do the results mean? So you've had your smear test, you've gotten your results. These are the three possibilities. So the first thing they do is they check for HPV. And if there is no HPV, then there's no high-risk HPV detected, and so you return to normal screening. You're good for the next 5 years unless you have any symptoms that are concerning. The next result you can get is there is HPV, but your cells are normal. So if that happens, they will repeat your screening in 1 year because, as I mentioned, your body can clear the HPV. So if there is HPV, but the cells are normal, so the cells have not changed at all, then they will repeat the screening in 1 year. There is something else you can do to help your body clear, which I have not put on a slide, but if someone reminds me to tell you, or maybe let me just tell you now. There are some vaginal gels and some tablets that you can use to help your body clear HPV. I'm not going to call any brand names, but basically what they do is it uses very natural products, mushrooms, all sorts of very natural things to put it in the vagina in this gel, and what it does is it improves the pH of your vagina, makes it more acidic, increases your immunity, and then helps you clear the HPV yourself. And so what I do for my ladies is if they have HPV positive normal cells and they're waiting that year for the next smear test, I recommend using this so that you can help your body to clear the HPV. Then the third potential is HPV positive and abnormal cells. And there are different levels of abnormalities. They sometimes say mild, they say moderate, or they say severe. And what that means is that there is high-risk HPV and the cells are abnormal. And so at this point, what happens is you are referred for a colposcopy. And a colposcopy allows us to look at the cervix more closely to see where are these abnormal cells and then take a biopsy if needed. So what is a colposcopy? So first of all, being referred for colposcopy does not mean you have cancer. It means that there are abnormal cells and we want to see how abnormal are these cells and we want to treat it. It allows us to have a closer look. And this is a picture that kind of demonstrates similar position to when you're having a smear test. It is a microscope that has a magnifying lens while looking at the cervix. And we put some dyes on the cervix. Sometimes it's a very mild vinegar-like solution or iodine solution to look at the cervix. Now, sometimes you're referred for colposcopy even if you haven't had an abnormal smear. And that may be if you have persistent bleeding after intercourse, persistent bleeding between your periods, and even though you've had a normal smear test, if that is happening, you will still be referred for colposcopy, or you should still be referred for colposcopy. So if this happens over 3 months, you can ask your GP to refer you for colposcopy. So what happens during the colposcopy? You lie on the couch, a speculum is used, we look at the cervix through the colposcope. the special liquids I mentioned. Dilute acetic acid is something like vinegar, really, really thin vinegar and some iodine solution. And then they look at the cells, at the vasculature underneath the surface of your cervix. And if they need to, they take a biopsy. Sometimes a biopsy is just like a little pinch biopsy. Sometimes it's a loop that they take with a little hot wire to take a loop. If they have to take a biopsy, they will give you local anesthetic, which is like with a dental syringe, really tiny needle to numb the area to take the sample. Usually takes 10 to 20 minutes, and then you wait for the histology to come back, which will then determine what happens next. Right, so even if you have a normal smear test, even if your last speculum examination was normal, if you have these symptoms, they need to be addressed. If you have bleeding after sex, if you have bleeding between your periods, if you have bleeding after the menopause, if you have an unusual discharge, particularly postmenopausal women getting an unusual discharge, women before the menopause, your discharge can cycle. As I mentioned, the mucus changes mid-cycle if it's all normal, but if you have an unusual discharge, that needs to be investigated. Initially, it will be with infection swabs, but then it may require a colposcopy. So even if you've had normal screening, you still need to see a doctor if you have any of these symptoms. Please do not ignore them. Okay, so alternatives. So from this year, there have been lots of techniques being developed to detect HPV. For example, self-swabbing, using tampons that are specially designed to detect HPV, or using pads that detect HPV in menstrual blood. But of all these really exciting, cool innovations, the one that has taken hold is the self-swab. And from this year, there has been a degree of rollout of offering self-sampling to women who struggle with smear tests, who don't attend for the smear tests, who have never attended for the smear tests. So if this is you, you can ask your GP, is it available for me? Can you request this for me? And they can try. It is slowly being rolled out, so you may not get that immediately. But self-swabbing has come, and that is fantastic. Now, pros and cons of the self-swabbing. It is absolutely fantastic. It can detect HPV. It's great if you feel embarrassed about going for a smear test, you're worried about pain, particularly if you've had a previous sexual trauma or you've had FGM. If you've got mobility or physical disabilities, for example, women with what we call contractures, where their legs are tight and they have difficulty opening their legs in order to have the speculum. Very busy with work, carrying responsibilities, difficult to attend appointments, or you find the examination difficult because of your sexual preferences. Now, so it's fantastic. It's going to help reduce inequalities. It's going to help for the women who struggle to get their smear test. But what you must remember is, if it's HPV negative, fantastic. Job done. If it's HPV positive, we still need to get those cells, and you will still need a smear test. And so for those who struggle, fantastic. We have an option, we have a solution, we have an alternative that is being rolled out. But please remember, if it does detect HPV, please do not ignore this. Please try and get that smear test done. Okay, some questions you may be embarrassed to ask that I'm going to ask for you, and I'm then going to answer for you. Can you have a smear test during your period? No, you cannot. If it's the very end of your period and they're just a couple drops of blood, that's not too bad. But if you are in the middle of your period, you cannot have the smear test. It's washing away the cells. We may not be able to pick up any of the cells. And you can't have, there are lots of things we can do for you when you're on your period. We can do an ultrasound scan for you. We can do a speculum for various other things, but we can't do a smear test. So as I mentioned, the best time to book it, just after your period. What if I'm a virgin? If you've not had any kind of sexual contact, you have not used any devices that are shared, then you don't necessarily need to have a smear test, but the swab might be a really good option for you just to make sure that there isn't any HPV. What if I have fibroids? We know fibroids are really common. A fibroid does not stop you from having your smear test. It does not, there's no reason a fibroid should stop you from having it. The only time a fibroid becomes a problem is if the fibroid is growing in the cervix and blocking access to the cervix, in which case this is very serious and that fibroid needs to be addressed to allow you to have your smear test. What if I've only had female partners? Well, that applies to the patients who are also virgins. If you've not had any penetrative, if you use shared devices or if either of you have previously had a male partner, I would still recommend that you have your smear test. What if I'm pregnant and my reminder has come to say I need to have a smear test? This is a time when you do not need to have your smear test. A smear test is not reliable while you're pregnant. It does not cause any injury to the baby, but it's not useful. If you've had an abnormal smear and now it's time for your colposcopy and you're pregnant, or they've seen something abnormal on your cervix and you need a colposcopy, you can have a colposcopy while you're pregnant because they're looking at the cells, they're looking at the blood vessels, but they're not kind of taking the cells. So you can have a colposcopy while you're pregnant, but you cannot have a smear test while you're pregnant. What if I'm postmenopausal? Well, that's okay as well. If you're on HRT, carry on as normal. If you're not on HRT and you're fine with the smear test and speculums, carry on. If you are struggling with vaginal dryness, the speculum is uncomfortable, stop at the examination. Ask for vaginal estrogens. It's not going to cause you any harm for that short period of time. And you have that prior to your next smear test. And if there are any other questions I've not thought of, please pop it in the chat. And I will try my best to give you some advice about that. Okay, so as a Black woman, what is important for you to know about cervical screening? Black women are less likely to attend for their cervical screening. And that's why we're talking about it today. I want to know, what have I not thought about? Why are our women not going for their screening? How can I help to change that statistic? Black women are more likely to be diagnosed as an emergency because they've not been for their screening or they've not been for when symptoms began, and then it becomes an emergency. They come to hospital with a problem, and then we detect changes and abnormalities and cancer. And Black African women have a higher mortality, so they're more likely to die from cervical cancer. And we have to change these statistics. Please help me change these statistics. Help me help you to go for your screening, to go for your testing. Tell me what is keeping you from going. Okay, so why? Why do we think? Black women are not more susceptible biologically. We're not, okay? But we have lower screening attendance. We have delayed presentation when we have symptoms, which means we are struggling to advocate for ourselves when we do attend. There is mistrust or previous negative healthcare experiences. If you've had a bad experience with person X, find a different person. Ask for a different GP in the practice. Change your GP practice. We now have, I think it's called Jess's rule. If you go 3 times about something and it's not been addressed, they have to refer you on. There's limited culturally appropriate information. That's why I'm here. Practical barriers, work, childcare, appointments. That's why we have the self-swabs. Comes to you in the post at home. You do it at home, you chuck it in the post, and it goes back for testing. We're trying to find ways to make it better. For some women, we've talked about the FGM, we've talked about previous sexual trauma, making intimate examinations difficult, and the swab is one solution. The person you see is another solution, and some of the tips that I mentioned earlier to make it less uncomfortable for you. So the problem isn't that Black women are more likely to get cervical cancer. The problem is that we're less likely to benefit from 1, the vaccination, and 2, the screening, and which has been designed to help prevent it. This is a condition that we should be able to eradicate because we have the vaccination and we have the screening. And I want to understand how to help my sisters, mothers, friends, daughters to get the vaccination and the screening. How can we do it? I want you to tell me. So my final word, cervical screening detects changes before they become cancer. And therefore it doesn't can, it's not that it can save lives, it does save lives. So I want you to book your smear. I want you to encourage a friend. I want you to have these conversations. I want you to protect your future and the future of your daughters. Thank you. Any questions?
Hello, Dr. Natalie. Thank you so much for that lovely presentation. I think we all felt, you know, more empowered with knowledge to advocate for ourselves. Just waiting for Dr. Von Shuro. She might have had a connection issue. There has been questions on the chat, so perhaps I would read one of those meanwhile. Someone did send a private question to me asking, does it hurt? I've heard mixed things, and that is partly why I keep putting mine off. I know this is something you approached during your talk, but one of our earliest questions as well, or I would say someone shared that they have not had the smear test done because they have been avoiding it. They have heard it's a scary procedure. So any comments on that, Doctor?
Yeah. Thank you. Thank you for asking that. Thank you for being honest and sharing about your fear and anxiety. It can be uncomfortable. It can, but it does not have to be. And there are definitely things we can do. There are definitely times I've had patients who have said, I've had a really bad experience before, and I'm like, okay, let's take this slowly. Let's change the direction of the speculum. Take a painkiller before you come. I use a small amount of lubricant, which you can do. In the past, we thought we couldn't use lubricant because it will affect the testing of the HPV, which is not the case. They can use some lubricant on the gel, on the speculum. And then I've talked about the swabs, chasing, see if your GP can get you the swab so that you don't need the speculum in the first instance. It does not have to be scary. It does not have to be painful. There are ways we can improve things for you, reduce your anxiety, reduce and make that not, an experience you want every Monday, but something you can do so that you can protect your future.
That was such an excellent presentation, Dr. Nunes. Thank you very much. And I have a question myself before I move on to the chat, because we've got
Okay.
quite a few and a few minutes for us, hopefully, to get through quite a few questions.
Okay.
So in our community, it's not unusual. You talked about the age group where people are invited for smears. It's not unusual for women to be virgins, in their late 20s, in their 30s. And I've had personal friends, I've known people who some have been traumatized, in their own words, with having a speculum, and then they talk to a friend who talks to a friend, and that sort of spreads the anxiety and fears. And I've seen in our chat someone already mentioned, I've heard that it's a very scary procedure, so because of that, and the significant proportion of our population that is in that situation, I was very delighted to hear about the self-swab. Because though not as ideal, and as you've rightly explained, you may still be required to do a smear if it's positive. I wanted to ask, so do women order this themselves? I know you said that how is it working? Do we request, and if we request, from who?
Yeah, that's a really good question. And at the moment, it is just being rolled out. So it's not on the NHS, the way to get it is to speak to your GP for them to inform the screening program to see if it can be sent to you. So it's via GP. Some people may do that privately. There are probably, private labs where you can just request that yourself and have that sent to you at home. But on the NHS, it will be via GP. You can't contact them yourself and say, hey, can I have a swab? But your GP can do that for you. It may not work initially, so don't give up. Because it may be that it hasn't reached your area or your GP practice or so forth, but please persevere. And what I would say about women who are virgins, yes, we do have a large amount, and what the HPV is transmitted during sexual contact. And if you've had no sexual contact, like if you've had sexual contact, which is not penetrative, but it's still sexual contact, then you should still be screened. If you've had no sexual contact at all, then your risk is so minuscule. Like, where would you have gotten it? It's unlikely to be from a toilet seat or anything like that. So if you are waiting for the swab, that is absolutely reasonable. If you have no symptoms, you're well, you've had zero sexual contact, then you can wait until that swab is available for you. But if you have had some sort of contact, then I would say pursue that swab. And try and get that done, even if you are a virgin and you've not had penetrative intercourse.
Okay. And what about sex toys?
Agreed.
Sharing?
If you share sex toys, then that can transmit the HPV. And so I would say yes, you need to be tested.
Which means women who have sex with men, women who have sex with women are all covered, and they're all at risk.
Correct.
Now, I'd like you to just highlight a few things on the vaccine, because we just got on the BBC published an article the day before yesterday, talking about how effective the vaccines are, and they're almost making the incidence or the prevalence, or it's the incidence of having cervical cancer almost zero because of the vaccination.
Yes.
But Black women specifically, I think we carry some racial trauma around vaccination and having trust in the safety of vaccines. Can you talk us through the pros and cons, the risk, and obviously we know the benefits now, but are there any risks that we should worry about?
Yeah. There hasn't been anything reported in terms of risks from this vaccine. I mean, the general risks of having a vaccine is you could have an allergic reaction to the vaccine. That's a possibility. But having the vaccine is not going to cause you to get HPV. It's not what we call a live vaccine, and you then get the infection rather than getting the protection. So, um, I think it's really a beneficial thing. I think the benefits outweigh the very minimal risks of an allergic reaction, and I would encourage having the
Yeah.
vaccine.
Wonderful. And I'm a mom of two boys and two girls, and
Okay.
actually, I was delighted to know that they give vaccines to boys as well. So, could you talk us through that access to the vaccines? Because someone has mentioned in our chat, and now I'm moving on to our chat to make sure that we start to address the questions.
Yeah.
But there is low uptake of the vaccines, particularly in our people, and I think you've mentioned that in your presentation as well.
Yeah.
Talk us through that.
Yeah.
Is there catch-up vaccines as well if you're an immigrant and you've come from abroad and you're 30?
Good question. Okay. So, when they rolled it out, it was initially for girls because this is about cervical cancer and girls have a cervix. But then they realized, well, the girls are going to have sex with these boys, and there are some cancers that HPV can cause in boys. And therefore, HPV can cause cancer in the anus, in the back passage. It can cause genital warts. It can cause throat cancers and so it's really important to not just protect our girls, but to protect our boys as well. And so then they rolled it out for the boys as well. Um, and um, it's rolled out via their schools. So in school, when they reach that age in the class, then a permission slip gets sent out to the parents. So that's how I know of it from my friends who've had it. Their kids got it that way. But if you've never been sexually active or you are older and you want it, unfortunately, the NHS will not give it to you because they probably don't believe you. And so unfortunately, you'd have to source that yourself privately. And you can get it privately and get the vaccine yourself. Unfortunately, the NHS does not provide it except for this age group.
I think that's an area for lobbying and maybe having discussions with the people who make these sort of decisions. Because in our chat, shout out to Loretta. She says, I've got a friend in her 40s. She's never had sexual exposure, but she went to a GP for vaccination and was fobbed off by the GP. I must declare that I'm a GP myself. I'm a proud family physician, and our desire is not to fob off people. And we really get excited when women present and ask about their smears and want to know about vaccination. So I'm sorry you had that experience, but what do women like her do? And maybe you've already answered this, Dr. Nunes, but so getting it privately, but is there anything else
Is there
that they could
anything?
do?
Sorry?
Is there anything else that these women can do? So maybe, the older women who wants to get the vaccine,
Yeah,
you've mentioned about getting it privately. I was just trying
yeah,
to think, um,
yeah,
anything else? I guess safe sex, maybe we
yeah,
could think about,
yeah,
practicing safe sex in terms of prevention, which is
yeah,
the key element of our primary care, um, delivery. I think you highlighted a key message in one of your slides where you said screening does not replace seeing your doctor if you have symptoms.
yeah,
And I think that's quite important because someone else in the chat has asked, what if you're over 64, and you're worried about getting cervical cancer and maybe you're no longer being called. Do you want to shed a little bit more light on that,
yeah.
or?
So if you have passed 64 and you've had any abnormal symptoms, bleeding after intercourse or just postmenopausal bleeding, you definitely must see your GP about that, and you will be examined and investigated. They may or may not actually do a smear, but they will look at your cervix, they will look inside of your uterus, and there are some new tests coming out where they can do a swab, which can detect things like endometrial cancer or exclude endometrial cancer. There's lots of exciting things in the future to help with these things. But if you've also had abnormal smears in the run up to 64, you can have a smear after that. Sometimes the way that we do the smear is not just the outer brush. Sometimes we need to use a slightly thinner brush as well to get a little bit higher into the cervix, because the cervix's shape changes a little bit after menopause, where some of the cells go a little bit higher up, and the brush goes a little bit higher to be able to get those cells to see if they're normal or abnormal. So if you are concerned because of your past history, or you're concerned because of your symptoms, please talk to your GP about it. And like I said, we have lovely GPs like Dr. Vaughn, but if your GP is not answering your queries and is not listening to you, talk to another GP in the practice. Ask to see a different one, or change your GP practice if you have to, but don't suffer in silence, or take someone with you. Sometimes it's difficult to advocate for yourself, and somebody with you can add in some words that can help move things along for you.
100%. Thank you so much. Yes, I will certainly be sharing with my GP colleagues about this, and hopefully we will become more accessible and more available. I just want to take this moment to acknowledge the viewers, Dr. Nunes, who joined us after we'd already done the introduction. Welcome to the show. We're talking about cervical screening today. It's been Cervical Screening Awareness Week, and we're so delighted that you could join us. If you've missed the beginning, do not worry. This is recorded, so you can watch back and write down all the points that Dr. Nunes was talking about. You can share with your loved ones, your social networks, your friends, family, and let's change the statistics. Let's address these absolute unjust health inequalities that are there. I'm deeply troubled by the statistics that you mentioned, Dr. Nunes. And I'm recalling our conversation on cervical cancer in International Women's Month in March 2024. I think we talked about this as well, just how women, as Black women, we're more likely to be diagnosed late, as you've said, but more of us at a younger age are more likely to die early and not to access treatment. And there's plenty of support groups, informations, which if you go back to that talk, Khan has kindly shared all the links that are there. So unfortunately, I had a technical problem and I rejoined and I lost some of my questions. So Natasha, I'm just going to need you to help me see if I've missed out on any other questions.
But one question which I'd like to address, someone has said, yes, I've had my womb and neck of womb removed. So that's a really good question. If you've had a hysterectomy and your cervix is left, you still need your smear test. But if you've had your cervix removed and your smear tests before that were all normal, and the histology of your cervix removed was normal, you no longer need your smear test. But if there was any abnormality or you had previously abnormal smear tests, then we do what we call a vault smear, which is a smear of the top of your vagina where the cervix was attached, and we do a smear of it there. But as I said, if everything was normal before, the histology was normal when your cervix was removed, then you don't need any further smear tests.
That's great. A slightly private question. How do I get a necklace like yours?
Ordered it online and got it in the States. I got it delivered there.
I think you need to share the link with our viewers, because we must absolutely not lose our voice as women. You know, we must advocate for ourselves, even if it means wearing jewelry that helps people to understand the importance of cervical health. I would like you to just highlight a little bit more about period awareness. We didn't go into detail about the symptoms and what they may represent. And I know obviously as a GP that the symptoms you've explained are not only caused by cervical cancer or cervical problems, there are other reasons as well.
Yeah.
But could you tell us a little bit more about what is bleeding after sex, bleeding in between periods, period awareness in general, you know? Can you,
Okay. Yep. Okay. So if you are not on any hormonal medication, you should be having typically a period once a month, about a month apart, anywhere around 4 weeks, 4.5, just so you know, anything around that is normal. And you bleed for maybe 5 days. Anything more than 7 is a bit long. Anything too heavy, where you're using double protection, is too heavy. But when the bleeding stops, it should stop, and you should not have any more bleeding until your next period starts. If you get spotting between your period, or the bleeding stops a week later, you have intercourse, and after you have intercourse, you see some blood, that is not normal. The most likely reason is that, well, I wouldn't say the most likely reason, but reasons can be, it can be something in the vagina. So, for example, you could have a thrush infection that made things irritable, that caused some spotting, that caused when intercourse happened, irritation, and caused some bleeding. Then it could be something on the cervix. It could be a polyp. It could be like a little skin tag hanging on the neck of the womb that during intercourse it irritated it, or just it spontaneously bled between your periods. It can be something higher up, like a skin tag or polyp on the inside of the womb, or an abnormality in the lining of the womb. And then sometimes it could be something hormonal, so something from the ovaries, a simple ovarian cyst, or a change in your hormones that month, or you didn't ovulate this particular month, and so your cycle just kind of got knocked off a bit and you had some bleeding, or the bleeding lasted 2 weeks. All of these things are not normal and should be investigated. And it could be something as simple as an infection. It could be something as serious as the big C word, cancer. But what it means is it could be very easily treated, or it could be something that saves your life. So if something is not in that realm of normal, monthly period, bleeding for not 7 days or more, not using double protection, not bleeding between your periods and after intercourse, then you're in the realm of normal, and anything outside of that should be checked. Now, the caveat is with if you're on hormones. So if you are on a progesterone-only pill, or you've got a hormone-containing coil, or then sometimes you can have bleeding in between, and we call that breakthrough bleeding. And it can be due to the hormones. Now, if it's happening, you still need to get it checked. And if everything is normal and it's not bothering you too much, then you can just continue with your coil and, with your progesterone-only pill. But it still needs to be checked that first time that it happens, because it could be something else. And we don't want to just excuse it and say, oh, it's because I'm on the pill.
Yes. And in the UK, GP services have never been more accessible, Dr. Nunes. We've got online consultation tools, which you may be familiar with, RQRX, Ask My GP, eConsult. All you need to do is just go online. After work, it doesn't need to be during the working hours sometimes, depending on your surgery. Visit your practice website and see what they say, and just submit a query. I guarantee you they will pay attention connection to you reporting these significant symptoms. Now, someone in our chat has also mentioned that they've got endometriosis, and I know women with endometriosis and other conditions can be on the pill, which then, as you're rightly highlighting, can bring a diagnostic challenge in knowing whether to worry about the symptoms or not. But I think the key message that you've told us is we must absolutely get things checked, isn't it? Now, I know it wasn't the focus of your talk, and you did give a disclaimer, but and I think you have done a good job in being inclusive to women who might have experienced FGM, female genital mutilation. But what about women who may have been born here and maybe they're facing the decision to have to do it or being asked to do it, and they're at that stage and they're listening today and they're thinking, do you have anything, thinking about the law safeguarding? Do you have anything to tell our viewers?
Absolutely. Legally, ethically, and from my heart, don't do it. Okay? It is illegal to do FGM, female genital mutilation. It is illegal to cut a woman's vulva. It provides zero benefit to you. It can cause chronic pain. It can cause urinary tract infections. It is unnatural, and please don't do it. If someone does it to you, they can be charged and go to jail for that. And I promise you, it is no benefit to you and no benefit to your daughters. Please don't do it.
Thank you. You couldn't have said it in such a compassionate and heartfelt way. I'm actually getting emotional just listening to you, because the injustice and inequalities around how women have been treated over the years, how female sexuality is undermined, and there's less awareness even of good sexual health, and and such a taboo around talking about female pleasure, which is absolutely important for our health. It's absolutely important. I'm so glad you made that point. Now, I just want to read through some of the comments in honor of our viewers who have joined us this morning, because this is the advantage of attending in a live session compared to watching back. It's the fact that we can interact together, and I know we're slightly over time, but I think if the moderators can just allow us a few more minutes just to acknowledge the women who've written in the comments. And obviously, if you're rushing for another appointment or you need to go, we absolutely respect that. Thank you so much for joining. Thank you for honoring this hour and empowering yourself to change the statistics around cervical screening, especially in Black women. So Rose has just asked maybe a more clever question. How reliable is the testing done at home?
Yeah, do you know what? It's the same labs doing it. So actually, as long as you follow the instructions, you get the swab nice and high and you move it around so that it can collect the secretions that you have in the vagina, and you send it. It's the same labs doing the testing, and it is as reliable.
Wonderful. And Geraldine has said essential information regarding a delicate topic, hence the mortality rates. We need more targeted strategies. Thank you for that comment. And education is one of those strategies. My GP, shout out to another viewer, my GP already knows I've been bleeding every day for 4 months. My question was about if the cervical screening can still be done, since you said that blood can ruin the test.
Yeah.
Your point about it being done during the period.
Yeah. So they can still test for HPV while you're bleeding, but they would not be able to get the cells of your cervix. My concern is, why are you bleeding for 4 months? And that needs to be addressed and get you to stop bleeding for your own health in that regard. Like that needs to be addressed so that, and then you can have your smear. So they can still test for HPV, but we could test for HPV in urine. I mean, like all these things are getting better at picking this up, but I'm concerned that you've been bleeding for 4 months and that needs to be addressed.
Thank you for that. And I agree as a GP. Question from Ellie, and I suppose your GP, if you're not sure, thinking about advocating yourself, if your GP has not already done that, perhaps getting advice and guidance from the specialists like Dr. Nunes, or actually doing a referral. So there's another point that says,
sorry to interrupt. That question that I wrote from earlier is from the same lady. She's just adding detail as to in regards to what she's going through, because at least she gave a bit more detail. So it's the same question.
Oh, I see. Okay. Thank you very much for that. Okay. Someone else said, I'm overdue my current cervical screening. So what happens there, Dr. Nunes? Someone is overdue. They just attend. Someone has said, I'm overdue my current cervical screening.
Yes, you just book it. You just attend.
Just,
so if you got the letter 1 month ago, 6 months ago, 1 year ago, 2 years ago, you just contact your GP and say, I'm due my smear. I got my letter and I've not come. Can I book in, please?
Yes, okay. And you've already kind of addressed about taking painkillers possibly before the procedures.
Yeah.
Someone has said, I'm in a lot of pelvic pain and discomfort as well because of this. So I think you've answered that. The bleeding was triggered by the Depo-Provera injection and now on Dinogest or Dynogest.
Yeah.
But the bleeding continues. Educate us on that, please.
Oh dear. That is challenging. Is that so this is for endometriosis, is it?
Yes, I think the person had said endometriosis and adenomyosis as well.
Okay.
Mm-hmm.
Yeah. So that is challenging. And I think that bleeding still needs to be addressed. So, whether they need to add in something else, whether you need a little bit of estrogen because the lining has now gotten so thin, because of the heavy progestogens you've been on. I still think your bleeding needs to be addressed. They can still test for HPV. And especially if the bleeding is light and it's just spotting, they can still do the smear test. So I think it's important to address both of those things, to get that smear and HPV test, as well as to get control of your bleeding while not compromising addressing your pain.
Thank you for that. And
I see a question about, is the speculum one size? No, it's not. There is medium, there is small, there is large, there is a virginal speculum, there is longer speculums, all sorts. The challenge with going too small, though, is if you go too small, for example, the virginal speculum, when you open, you can't see the cervix. So, but if the size that they've used, which the average size they would use medium, you can ask for the small. And I think sometimes the pain is not just the speculum going in, but that opening bit. So, you can ask them, once you see my cervix, could you not have it so open and bring it down a little bit? Because once you need to open it to be able to get the cervix in the right space. But once you get it there, you can bring it down a little bit so that you don't feel that stretch. But yes, there are multiple different sizes of speculums.
That's fantastic. And you talked about taking a friend as well to help to advocate. And I can say from a clinician perspective, a good practice, we should be offering a chaperone as well. And you can ask for a chaperone to make sure someone is there who can hold your hand if you need to, or you can just ask a question while the doctor is busy doing what they're doing. Someone swiftly moving on to another comment, I read that we shouldn't have the test of bleeding, and I think they're right because you've said that in your talk, Dr. Nunes. She also says I also have complex PTSD. so I do struggle with having the test done. What do you recommend that I do? And I think you've already kind of answered that during the presentation, but I don't know if you've got any final words to say to women who might have joined us later, or asked us this now, just as a final word as we look to conclude our conversation.
Just before I give my final word, I see someone called Natalie, great name. Yeah, has taken off of the NHS website some further information about who gets the HPV vaccine free. And so it's not just the 12 to 13 offered in school. Young people who missed it at school can also get it. Those under 25, which I did know, boys on or after September 2006 who are under 25 have also been offered it. But they're also offering it to men who have sex with men, other high-risk groups, people living with HIV, transgender people who are considered to have a similar risk to men who have sex with men, and sex workers. So it looks like they are broadening who is being offered it, realizing that there are benefits. So if you fall into any of those groups, or your daughters or your sons fall into any of those groups, and here's your opportunity to get them their vaccine before they cross 25, or for whatever reason on that list they may be suitable. So my final words. Black women we've not been listened to. We have struggled with late diagnosis. We have gotten the short end of the stick for many, many, many things. But in this thing, we have the power to protect ourselves and protect our loved ones. So I am such an advocate, and I truly believe that the vaccination for HPV and cervical screening can save lives of us and our loved ones. And I encourage you all, please get these things done. If you are eligible, if you are in that group, please get them done. And if you can't and you don't want to, or you're afraid, find someone, take someone with you, talk to someone else, talk to your GP, ask to be referred, do something. Don't just sit in silence and suffer. This is a situation where we have the power to do something for ourselves, and I encourage you to do that, please.
You are such an inspirational trailblazer, Dr. Nunes. How can we get hold of you online? Do you have social media handles so that we know about all the virtual reality headsets and all the amazing things that you do?
Okay, so I am on social media. I'm on Instagram and TikTok. My handle is Golden Gynaecology, because I believe that in gynecology we can live a golden life and we can find the things that we need to do so. I also have a website, drnatalienunes.com. So please send me a DM. I manage it myself. I answer the questions myself. I can't give health advice, but I can give general advice, and I can point you in the right direction. So send me a message.
That is fantastic. And if we haven't addressed your question properly, or you think of a follow-on question, please, please, please do email healthhour@can.org.uk. So that's healthhour@can.org.uk. Someone has made a comment that I'm going to conclude with. God or nature or the universe, whatever you believe in, has made us whole. Why cut our lives short? Why cut us short? It's always a good time to have hope and to improve our health outcomes, increase our life expectancy, and benefit from what, as a society, we are doing collectively to improve the lives of women. It's a beautiful day. It's Windrush Celebration Day as well today. So please, if you know someone who's affected, do reach out, say a thoughtful word, give a friend a call. Again, shout out to our CAN members who have logged into this talk from all the way from Manchester to acknowledge this beautiful day. Dr. Nunes, it's been such an honor for me, such a pleasure to meet you. And I look forward to connecting with you privately and just learning a little bit more. Once upon a time, I wanted to be a gynecologist. So I feel like I'm looking at my ideal self.
Yeah.
And it's been such an absolute pleasure to talk with you this morning. I shall now hand over to Ashanti. Ashanti, are you ready to take over and just take us through the final talks or announcements for our session this morning? Thank you for joining us. To all our viewers all over the UK, across the world. I know I've got family in South Africa, Namibia, Canada, who I've told about this talk, Australia. Thank you for joining us wherever you've joined us from. Please find out all this information where you are. Ask your service providers because the rules are different. Healthcare provision is different. We know that health inequalities sometimes affect access in different areas, but please don't ignore the symptoms that have been mentioned. And if you've got more specific questions, again, email us, contact Dr. Nunes via her handles on her website so that you can know how to protect yourself and your loved ones. We look forward to having you again in our next Health Hour talk next week. Thank you for joining us.
Thank you.
Bye-bye.
Bye-bye.
Thank you very much for educating us today, Dr. Nunes. Thank you so much for the wonderful hosting, Dr. Shuro. I mean, these doctors give up their time. It's completely free. So we at Khan are so grateful for, the sacrifice. So I'm going to share my screen. Please do tell me, if it's being shared, technology and so on. Can we see my screen?
Yes.
Okay, wonderful. So I'm just going to share some few announcements and so on. We at Calm, we run the Health Hour every week. It's running 50 weeks of the year. So please do join us. Next week we're having Dr. Aloka talking about prostate cancer. We're going from Black women to Black men. Please share, let everyone know, same time. There's so much to benefit from. Today we're having our Windrush Day, so it's a huge event, a huge moment. The legacy of the Windrush generation continues to live on. If you're in Greater Manchester, have anybody in Greater Manchester, please do come along. They'll be in Alexandra Park from 12 p.m. to 6 p.m. It's going to be a wonderful day. There's live music, football, loads of good stuff. Please do get involved if you can. Share to anyone who you think would enjoy it. We have the Black Healthcare Awards coming up on the 4th of July. It's really important to recognize our Black healthcare workers. And it promises to be an absolutely unforgettable night. So please do, buy tickets. The evening includes a host of very wonderful things. The QR code is there. And you can contact the email on screen as well to access tickets. Back to Windrush. Like I said, the park celebration is happening today, but we also have a scheme where we can help you claim the Windrush compensation if you or anyone that you know is a part of that generation. So again, please do get in touch with our advocacy team. The kind of details are on the screen, and share again if you know anyone that would really benefit from this. Additionally, we at Khan run green and art wellbeing services. Health is your total well-being. So please do come along. It's in Bolton, Stockport, and Gorton, as you see. There's loads of things to get involved in terms of creativity and celebrating wellness. Equally, we run a Black-led counselling service. Mental health is absolutely important, and having that culturally appropriate or tailored mental health is something we really pride ourselves on. So please do get involved or, like I say, if you know anyone that would really benefit from this, do share. Again, the email is on the slide. And of course, we also have links on our website. Again, thank you for joining us today. You know, we really hope to see you all next week and beyond.
And that's our time for today. Whether you joined us on Zoom, Facebook, LinkedIn, or YouTube, thank you for making the Health Hour part of your Saturday. We hope today's session gave you the right dose of health wisdom that you can share with your friends and family. When we share knowledge, we strengthen our entire community. Mark your calendar. Next Saturday, same time. Got a topic in mind? We want to hear from you at health@can.org.uk. Health Hour, hosted by the Caribbean and African Health Network. And that's our time.